So in this episode, I'd like to welcome Ebubechucwu Obiora. Welcome to the podcast. What definitely solidified that decision to go for medicine?
What really solidified myself pursuing medicine is...
what would you probably say about medical school in of itself? Would you say it might be as hard or as miserable as some might say?
Okay, so that's a great question. Before I enter, or your third year in this program is going to be the hardest thing. Yeah. Other people are going to say your second year in the med school portion is going to be hardest. I was like, first year is the hardest because of physics. Now you see, it's just so many conflicting opinions. Anytime we walk through the park, you either see another brother or another sister, they congratulate you, come up to you like, hey, great job, keep it going. Or like me when I'm going to the hospital in scrubs, see a black man in scrubs, they're just like, wow.
Yeah, I was on the bus. That happened to me yesterday.
Exactly.
What would you say would be your long-term goals after you finish medical school? Hey, my name is James Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I have something very special. I have a special guest here that I'm going to have a conversation with, and I think anyone who's listening is really going to enjoy this. And to get this started, our guest today, he is a current second-year medical student at the CUNY School of Medicine. He holds a Bachelor of Science degree with a major in biomedical sciences. He recently did the NIH T35 program at Columbia University. He is a class representative for the CSOM class of 2026. And so in this episode, I'd like to welcome Ebubechucwu Obiora. Welcome to the podcast.
Thank you. And thank you for having me. You talked about your podcast a little bit over the summer when we worked together as peer tutors. And I'm excited to be on here and be part of it. I feel like the mission of this podcast is great. And not a lot of people know the perspective of what we go through. And especially we ourselves don't even fully understand what it is that we're going through and where we're going and what we are going to face in the future as well. So thank you.
Of course. Now, thank you for being on the pod because, already started going. I think it's going to be a pretty good episode.
I hope so.
Yeah. So I know I gave a little brief introduction, but would you mind giving a quick introduction to yourself? Let the people know who you are.
Introduction about myself. So my name is Ebubechucwu Obiora. I was born in Nigeria, but I'm from Long Island. That's where I mainly grew up in after coming to America. I graduated from Elma Memorial High School 2019, and my mother still is a nurse. She was a registered nurse. Now she's a nurse practitioner pursuing her doctorate degree. And honestly, she was my main inspiration for going into the healthcare system. As a child growing up, I just remember her always sharing stories about her elderly patients because she was in palliative care, and each patient had their own story, and just the way that all of these medical conditions developed and what she saw, her interactions. She would come home sometimes. I remember her when she lost her first patient. She was very sad, very depressed. Not depressed, but just very, very sad on it. And it's just and then as time went on, and I just witnessed her grow in the field and what that does to a person, and it just lit a fire under me. And my dad was supportive throughout my entire endeavor into going into med school and things like that. Aside from med school, of course, as introduced, I love medicine. Aside from that, I used to play football back in high school. I love football. I used to wrestle as well, but my main passion was football. And I like watching anime. That's my brief introduction about myself. And I want to go into anesthesiology.
Cool.
So.
Yeah, so I definitely want to ask about that pretty soon. But before all of that, though, you mentioned a lot of things there that I thought was super duper interesting. So I'm wondering, in terms of what you've seen, in your story and looking back in hindsight, what really got you pursuing medicine in the first place? I know you mentioned some things about your mother, and you also mentioned some of the other passions that you also had along with that. What definitely solidified that decision to go for medicine?
It's kind of funny. So, okay, Yes, I always wanted to pursue medicine. What made me pursue medicine or come to this school?
It could be both actually, because
Okay.
you're in medical school.
Okay. So, pursuing medicine, what really solidified myself pursuing medicine is when I was thinking to myself, what do I want to do with my life? This was in 10th grade. Thinking all the future careers, and I realized something. Because for the longest time, I wanted to be a teacher. But I wanted to be a teacher since kindergarten. I loved the whole aspect of teaching people things. And that aspect of myself never went away, as it's still part of me. I love mentoring, I love tutoring. I sign up for mainly any opportunity to do so, whether it's tutoring incoming students or tutoring classmates who are a year below me or even further below that, or even like some volunteer clubs like In Arms Reach and Switch It Up, Break It Down that we had here at CCNY, where we mentored and tutored healthcare classes for elementary kids, and one was even high school kids. That was I forgot the name of the club. But yeah, so I really love that aspect of things. So that love for teaching, it never left me. However, when it came to time to think of future career, something that is ever changing, I just wanted something that I love puzzles. I love figuring things out. I love growing, and I feel like healthcare is just one of those fields where it's endlessly growing. Of course, yes, other fields are endlessly growing as well, but for me and the way my brain works and how even the human body, like how it works, all the capabilities of it, the extent of that's the amount of things just compacted into the human body. It's just amazing. And I could go on and on about why I love medicine, but it just kept on growing. And the more I learned about it, the more I grew on it.
Yeah.
And
yeah. No, I can definitely relate to that one for sure. You know, so thinking about that whole journey that you kind of been on to even get to this point, because first going through undergrad, then getting to your second year medical school now. What do you think is probably the most important thing, or the most important things you feel like you've gained, like actually being in medical school?
Okay, so during my stay here.
Yeah.
So the most important, I have to say, a support system. That's the most important thing to get through this program. Thankfully, this school is very diverse, and we have a lot, and I mean a lot, of interaction between all the years. It's basically like a mini family. Of course, in mini families, you have your favorites, you have there's sections, there's all of these cliques and things like that. But also, there's a lot of crosstalk. A lot of people know about a lot of people, and it's really nice. And you have upperclassmen who went through the same program. You have underclassmen who are going through that program, getting advice. I started off in my first year asking others. Now people are asking me. It's like passing the baton on. Yeah. And just that network, support system, close group of friends who you can talk about intimate things, like whether you're having issues in school, mental health issues. There's also provisions for that at the school. So there's a lot of support provided. And this isn't something that, sure, there are some exceptional individuals who can go through it alone, but it just is not healthy to go through this alone, especially as a black man or a black woman, or just in general an underrepresented member of this community. Going through this alone can be intimidating, and without a support system, it most likely will lead to a higher chance of failure and things like that. So the support system is definitely
So going off at that point specifically, especially being, as you mentioned, like in a BSMD program and that sort of thing, and a very longitudinal and long-term process, but ultimately going through, medical school and the challenge that is medical school. And I think I remember even having us having a conversation maybe quite a while back, or being a part of a conversation, but a lot of times I think there's a lot of preconceived notions, whether accurate or inaccurate, like a lot of preconceived notions about like what medical school is and medical school is like, what the challenges are like, even just whether it's people going on different like forums and stuff like that, or seeing on social media. Like there's so many things that I think are often talked about, and I think one of the things I probably noticed is it can often be extremely negative for sure. I think people are probably pretty real, about the challenges they go through. But I also do think maybe to some extent people do kind of get discouraged about it as well. But definitely think about what you've been through to this point. What would you probably say about medical school in of itself? Like, would you say it might be as hard or as miserable as some might say? Or
Okay, so that's a great question. Before I answer it, so generally you have to think about it. So you remember in when we learned about research and survey bias.
Mm-hmm.
So in general, if somebody is taking the time out of their day to go to a forum and then write a review on something, most likely it's going to be for a negative reason. And this is not to discredit the individuals or their experiences, as they're very real. And a lot of people do have negative experiences. But it's the same way how a lot of people who ask me, oh, what was the hardest class in your opinion? Or what was the hardest module in your med school year? What was the hardest part of undergrad? The hardest part for me is not the hardest part for you. And it's not the hardest part for my classmate. It's a very individual thing. Everyone has their own individual strengths and individual weaknesses. And everybody's understanding and grasp of the material is very different. So because of that reason, I often try to just tell them, hey, you're going to hear a lot of things. You're going to hear about, the fundamentals of organ system is going to be or your third year in this program is going to be the hardest thing. Yeah. Other people are going to say your second year in the med school portion is going to be hardest. I was like, first year is the hardest because of physics. Now you see, it's just so many conflicting opinions that it's a really case by case thing. Mm-hmm. Again, not to discredit the forums. The forums, I understand, and there's always negativity, but don't let the negativity have you shut doors that you haven't even looked at yet. Yeah. Because one class that somebody took and had a bad experience in, you could take that class and have the best experience of your life and learn something that can propel you into the future and arm you with what you needed. But how would you know if you never took that endeavor? No, so true. Don't block your blessings, You never know. You'll hear something about someone, or you'll hear something about some class or something about some professor, and then you're just like, oh, I'll just stay away from it. But you stay away from it, and then... But hey, everybody has their own opinions on that. But personally, now for my answer to the question about the hardest part.
Yeah, or... I guess we're just, if you think like med school is
just okay. So med school in general. So not okay. That's good. Yeah. So med school in general, med school is doable. Other people have done it. Other people will continue to do it. Yeah. It's doable. Now, med school, my opinion on it is that it's a higher level thinking. It's not only just of volume of information being thrown at you, it's understanding. Majority of the class understands what each individual thing is. If you explain it to them, they understand, they grasp it. It's not about being smart. A lot of my peers, very intellectual individuals. Yeah. It's applying. It's appliance of the knowledge. It's how you understand how each component works and how you can integrate it. And this is even going to be further emphasized in the future years when you're doing clinicals, when you're seeing actual patients, because actual patients are different from the question stems. But that's why you have your clinical years and you have your didactic years. Yeah. But it's definitely... a lot of people say the fire hydrant, like it's drinking from a fire hydrant or drinking from a fire hose.
I think I kind of saw that my first year. It's kind of true in my opinion.
It's just a massive information just being thrown at you, and you just have to pick and choose. You have to pick and choose your battles, because you're just like, okay, you'll do a mass content review, but then the concepts, there's key concepts that you have to grasp, because those key concepts will help you understand everything else. And if you don't know what you're looking for, it's very easy to drown in that fire hose. Yeah. So that's my outlook on med school.
Yeah, no, that's a lot of good points there. Definitely relate in terms of something like the navigation part and like the fire hydrant, and being able to really learn how to kind of pick and choose those things. Yeah. I think that's maybe something that a lot of medical students probably get tripped up on, or some do, in terms of kind of trying to take on that overwhelming amount of information, but not going in knowing like what they need to get out of that, to ultimately apply to like, when it comes to like clinical sort of applications to this stuff, and what that looks like in the case of, healthcare, not just a bunch of information. Definitely moving forward, there's something I definitely want to ask you about because I know you've mentioned probably pretty extensively, the interest that you have in like going to the field of anesthesia. Like I know there's a lot of medical students who, even up to like their third or like fourth year don't really know or have any idea what, they want to try to pursue, medical school. But I know for you, even I remember when you were, I think, a first year, mentioning that like anesthesia was something that you were like looking to go into. How did that kind of start out?
So that's a great question. So actually, it was towards the end of my first year that I switched to wanting to do anesthesia. Initially, coming into the program, I was thinking of either cardiothoracic or orthopedic surgery.
Interesting.
I just love the OR. I love just the aspect of you go in there, elbows deep, fixing whatever's going on. In orthopedics, again, just coming off of high school, loved football. I was a sports guy. I wanted to go into orthopedics because I wanted to be in the field of like helping athletes and things like that. And cardiothoracic surgery, that came about because of Grey's Anatomy. I was watching it at the time, Dr. Burke. A lot of people in high school were like, "Oh, you look like Dr. Burke. You look like Dr. Burke." And then, I don't know. I guess through repetitive hearing, it started fixated on that somehow. But I also just thought it was pretty cool, like the heart. And then once upon a time, it was plastic surgery because of like first year I went through a lot of mini phases. It was like okay, cardiothoracic, okay, orthopedic, oh, plastic surgery, because Dr. Sloan, I was like, oh, plastic surgery, he looks like he's calm, he's chilling, like he looks like he's in good health and things like that, because a lot of people, the way doctors are depicted on TV, stressed, scrambling, like, oh, like thousand things going on in their head. But then with the plastic surgery, it's like, oh, he's chilling, calm, life. But ultimately, what led me to anesthesia was kind of just, it wasn't a personal experience, but essentially, specifically pain management. But pain management came a little bit later. But anesthesia, I love the OR. However, rather than being in the front lines, in there fixing the thing, I wanted to be, rather than on the side of medicine, I wanted to be on the side of the patient. Not to say that the side of the patient is separate from medicine, but it's just that rather than fixing the medical problem itself or whatever is going on, I also want to be there as a comfort to the patient. I feel like anesthesia is more of an intimate role with your patient. You walk through the procedure in the beginning. Of course, the surgeon also does the same thing, but you're the one who's there to make sure that they don't feel pain afterwards. They don't wake up during the procedure. You're checking their vitals constantly. If their vitals go left, it's your duty to make it go right. Blood pressure drops out of nowhere, that's a problem. And the cardiothoracic surgeon is over
they're just busy cutting
their heart. So the anesthesiologist is like, all right, we gotta fix this, So it's just that role. It's like the second king of the operating room, if that makes sense. But I'm definitely still learning more about the field. I haven't fully gotten a grasp on it in the sense that I did research over the summer. I was able to shadow. Fortunately, I appreciate my time there at Columbia. It was a great experience. I was able to see a lot of surgeries and learn a lot through the attendings. So through that, the more I'm exposed to anesthesia, the more I love it. That's what drew me to that.
I think that really speaks a lot to me. I think in terms of processing that, I think for sure that's probably quite different, even from my own, I would say, kind of like pre-supposition by anesthesia, still like learning more about different specialties and things like that. I think it's definitely pretty interesting. You mentioned like being like on the side of the patient, like being the one who's like walking them through the entire process, and I think that obviously is a perfect example of what it means to like really be, a part of medicine, and all those things. I do want to transition a little bit. I know we spent quite a lot just talking about really your med school journey and how you've gotten to the point of the specialty you're pursuing, how you're getting through med school at this point. So one of the things that's very significant about this podcast, I think, even as you mentioned earlier, is just how when it comes to like less than 3% as a podcast, I'm really trying to look to be able to speak to a lot of the issues that relate to whether it's systemic racism in medicine, whether it's healthcare disparities, whether it's just people from diverse backgrounds being involved in medicine and wearing those white coats and being able to help serve people. And I just wonder, what do you think about, or do you think there's any sort of significance about being a black man in medicine or a black man pursuing medicine, even from the stage that you're in? And like, what do you think that's about?
Is there a significance? Yes, there's definitely a significance. So there's significance for multiple reasons. We can talk about. Okay, I'll focus on its representation. At the end of the day, if you rewind the clock to 100 years ago,
Yeah.
how many African Americans went to the doctor and the doctor was an African American? Now you can rewind it 50 years ago. Even in today's time, it's still very, like your podcast, less than 3%.
Yeah.
It's not as prevalent. Now we can go into the reasons why, but the main thing is representation, being there, a familiar face, not in the sense of, it just creates comfortability.
Yeah.
It's the same aspect of equitable healthcare. If you're serving a predominantly Spanish-speaking community, you would want your staff to have
some
Spanish
ability
speaking.
to speak that.
Yeah. So there's a language barrier. There's also a cultural barrier. And cultural barrier is where I feel that it's more important for African Americans.
Yeah, for sure.
And why it's very important for us to get in that field. Because the cultural barrier is the big thing that's killing us, both literally and figuratively. So you can speak on, yes, a lot of African Americans know how to speak English. It's not a language barrier. We're communicating, but we're not being heard. Now, the reason we're not being heard can either be a cultural gap, or it can be because of just biases.
Yeah, I would just say biases.
Yeah, there's a lot of biases in the healthcare community, whether it be healthcare biases or personal biases. And let's not forget, doctors are humans, and humans have their own internal outlook on the world.
Yeah.
And that influences your decision. Even if we take a code, even if we are supposed to be essentially borderline machines just operating for the sake of medicine, you would be lying to yourself to think that doctors don't have their own views on the patients that they treat and things like that. And those views can sometimes, unfortunately, impede their ability to provide proper care. So representation, increased cultural competency in the healthcare community. I feel like that's another important, and even just it boosts morale. It shows the kids that, hey, you can do it. Yeah. Just because you were born this color doesn't mean that certain jobs are cut out from you. Yeah. Even when our white coat ceremony, when we were walking to get to our graduation in white coats, anytime we walk through the park, just you either see another brother or another sister, like, whoo, like they congratulate you, come up to you like, hey, great job, keep it going. Or like me when I'm going to the hospital in the scrubs, see a black man in scrubs, they're just like, wow.
Yeah, I was on the bus. That happened to me like yesterday,
exactly,
2 days ago.
And it makes you, it lights a fire, and it's like, wow, like you're doing this for a purpose. Even in the hospitals, the encouragement that you get, like, oh, hello. I was like, oh, wow, you're a doctor? And I'm like, no, I'm a medical student. And you're like, wow, good for you. And just that encouragement, both in church, in person, in the hospital, it's just, it's nationally recognized. Yeah. It's seen as an accomplishment. Yeah. And
Oh, for sure. Yeah, I definitely think there's so much to that. You know, a lot of things that everyone continue to talk about, you know, even on the podcast when it comes to a lot of those different things. Really just to kind of close this out, there is another question I do want to ask you. So we talked about, you know, your medical school path. We talked about, you know, your specialty pursuits. We talked about even you being a black man in these shoes and pursuing this thing. What would you say would be your long-term goals after you finish medical school? Let's say even after you've gotten that anesthesia, you know, certification, all of those things.
So long-term goal for me would be, after I become an anesthesiologist, would be to actually enter fellowship. To, at least right now, my most likely plan would be to enter pain management.
Yeah.
I feel that in terms of healthcare diversity, pain is very disproportionate in treatment, especially if you look at the race statistics, and it's even documented in certain literature that's fairly recent. This is not old teachings. That's recent, especially with the whole black individuals have thicker skin.
Yeah.
And so they feel less pain. So like documents like that was recent. Yeah. So I feel like establishing pain management clinics is a big step, and that's typically where I want to go into to get the proper training, the proper treatment for these patients who are suffering. And of course, there's the whole opioid epidemic that's going on.
Yeah.
And which communities is it mainly killing?
I see.
So proper prescription of these medications also needs to be done, proper protocol and proper treatment plans to make sure that they're not accidentally overdosing or things like that.
Yeah.
And it's something that I just became more and more passionate about, and I feel that pain is really not as addressed or not looked at, because pain, it doesn't kill you, but imagine living every day in constant pain.
Just constant
you can't
pain.
sleep, you can't hold your daughter, your son, you can't pick them up like you used to. It's unfortunate, and I feel that it's something that needs to be addressed, and I would love to make a difference in people's lives.
Yeah, no, definitely. And I think we definitely need a lot more of that, in the black community for sure. When we talk about those disproportionate sort of outcomes and things like that.
Yeah.
I do want to hit you with one last rapid fire question.
Mm-hmm.
So, if you had one quick piece of advice for aspiring medical students, what would it be?
Don't doubt yourself. Aim high. If you want to do something, do it. If you feel like it's taking a long time, or you're thinking, you have to take this gap year, or you have to retake the MCAT multiple times, or you have to take a year off. Listen, no matter how old you are, you're going to get older. That's just the fact of life.
Yeah.
Like, you're gonna hit 30. You're gonna hit 40. Wouldn't you rather hit those numbers doing what it is that you're passionate about, rather than settling for something because you were worried for time? Because then time will pass and you'll still be in that spot that you didn't want to be in the first place. And then you'll hit that age and you'll think to yourself, wow, I could be a doctor right now. Yeah. But of course, if that's what you want to do, if that's what you're passionate about, don't let people think that you can't do it. We're doing it.
Yeah.
By God's grace, we will do it.
Yeah.
And there's many people who came before us. Many of us will come. Many people will come after us, and you could be one of them. So,
yeah. No, that's good. Definitely, that's a fact. So that pretty much wraps up this interview. I want to thank you again for being on the podcast. Imparting that wisdom.
Wisdom.
Yeah. So, with that being said, I hope everyone who's watched this interview, you really maybe enjoy this and take a lot out of it. And I'll see you in the next one.